Social Security reductions are creating widespread disruption, and older Americans were never clearly told what was ahead. Officials described it as routine budget changes, but millions of people over 60 are now calling it something far more serious, a full-blown crisis. Across the nation today, seniors are checking their mail and discovering smaller payments than they expected. Phone lines for Social Security offices are overwhelmed. Hold times have skyrocketed. Local branches, the same ones people depended on for decades, are closing permanently. And those who can least handle uncertainty are the ones being hit the hardest. We are talking about your retirement income, your Medicare coordination, your disability support, the benefits you earned through decades of work. Even Republicans, the same group that supported these reductions, are now raising concerns, saying their own voters are being negatively affected. When leaders from both political sides begin using terms like chaos and crisis, it is something you cannot ignore. So what exactly has been reduced? How is it impacting your benefits right now? And most importantly, what steps can you take to protect yourself before the situation worsens? In this breakdown, we explain everything clearly. No political bias, no confusing government jargon, just straightforward information every American over 60 should understand. How did we get here? The original promise of Social Security. To truly understand today's situation, you need to look back at how this system began. The Social Security Administration has existed since 1935. President Franklin D. Roosevelt signed it into law during the Great Depression, when millions of older Americans had nothing at all. No retirement savings, no pensions, no form of protection. It was created out of both urgency and compassion. For nearly 90 years, it has served as the financial foundation of retirement for working Americans. You contributed to it throughout your career. Your employer contributed as well. It was a promise, an agreement between you and the federal government that said, you work, you pay in, and when your working years are over, support will be there for you. Today, that promise is being shaken. For decades, the Social Security Administration operated with thousands of employees working in offices across the country, from Maine to Hawaii, from Alaska to Florida. These were not just office workers behind desks. They were real people helping real individuals. They assisted neighbors, families, and friends in navigating one of the most complex systems in the nation. They helped people apply for retirement benefits. They helped families claim survivor benefits after losing loved ones. They supported disabled Americans who depended on assistance to get through daily life, and they provided that help face-to-face in communities everywhere. Then the cuts began. What was reduced and why seniors are struggling? What started as a discussion about improving government efficiency quickly turned into something much more damaging for millions of seniors. The argument from those supporting the cuts seemed simple. The federal government spends too much. Social Security administrative costs are part of that spending. Reducing those costs would save taxpayers billions. On paper, it sounded reasonable. In reality, it felt very different when your local Social Security office shut down permanently. And that is exactly what is happening. Offices that served communities for decades, sometimes 30, 40, even 50 years, are closing. Hundreds of them, especially in small towns and rural areas. For many seniors, those offices were the only place to get in-person assistance. When they close, there is no backup option, no nearby replacement office, just a phone number, a number that often goes unanswered. What this looks like in real life. This is not just a policy discussion. This is about real people. Imagine being 72 years old. Maybe using computers is not easy anymore. Maybe your eyesight makes reading small text online difficult. Maybe you are dealing with early memory issues, and complicated forms feel overwhelming. You have been trying to fix a problem with your Social Security payment for months. You have called the main number dozens of times. You have waited on hold for hours, only to get disconnected before speaking to anyone. You drive to your local office only to find a notice on the door saying it has permanently closed. What do you do next? Who can help you? This is the reality for millions of seniors across America right now, and it is not exaggerated. Reports from advocacy organizations, senior centers, and members of Congress all confirm the same pattern. The disruption is real, the confusion is real, and the damage being done to vulnerable individuals is very real. Even Republicans are speaking out. What makes this situation even more striking is that some of the strongest criticism is coming from within the Republican Party itself. Lawmakers who supported reducing government spending are now hearing directly from their communities. They believed in cutting budgets. They campaigned on it. But after returning home, holding town halls, and listening to constituents, many are saying the same thing. This has gone too far. It is harming the wrong people. One senator from a rural Midwestern state described hearing from elderly residents who waited 6 months just to get a basic question answered. Another representative from the South reported being overwhelmed with calls from seniors unable to fix disability payments, resolve Medicare issues, or even reach a real person at Social Security. When officials from the same party that supported these cuts begin to push back publicly, it shows how serious the situation has become. Why this goes beyond monthly checks. This issue is bigger than just retirement payments. The Social Security Administration does far more than send monthly checks. It manages Supplemental Security Income, or SSI, which helps low-income seniors meet basic needs. It oversees Social Security Disability Insurance, or SSDI, supporting people unable to work due to illness or injury. It handles survivor benefits for families who have lost loved ones. It also works closely with Medicare. That means when Social Security has problems, those issues can directly affect your healthcare coverage. When funding is reduced, staff is cut, and offices are closed, the effects do not stay contained. They spread, they grow, and they impact those who rely on these programs the most, often the oldest, the sickest, and those with the least financial stability. Real-world consequences, overpayments, delays, and confusion. Let's look at how these cuts are affecting people day to day. Overpayment recovery is one major issue. Sometimes the Social Security Administration makes a mistake and pays someone more than they should have received. When that error is discovered, even years later, the agency can demand repayment. In the past, these cases were handled more carefully. People had time to respond, options to repay, and the ability to appeal. Now, with reduced staffing, the process has become harsher. People are receiving notices demanding thousands of dollars back with little explanation and very little time to respond. For someone living on a fixed income, getting a letter demanding thousands of dollars is not just stressful, it is frightening. Survivor benefit delays are another serious problem. Losing a spouse is already overwhelming. At the same time, individuals must navigate the system to claim benefits they are entitled to. Before these cuts, while still complex, the process was manageable. Now, many are waiting months just to have their case reviewed. Some are even hiring lawyers for something that used to be handled in person. Medicare coordination is also becoming chaotic. Since Medicare premiums are often deducted directly from Social Security payments, errors can spread between systems. People are finding their coverage incorrect, claims denied, and fixing these issues has become extremely difficult. What you can do right now. First, access your official Social Security statement. Create an online account if you have not already. Review your earnings record carefully to ensure everything is accurate. Errors can reduce your benefits. Second, keep records of everything. Save every letter, every form, and document every phone call. This documentation can be critical if problems arise. Third, be strategic when contacting Social Security. Call early in the morning or midweek to reduce wait times. If an office is still open near you, visiting in person can be more effective. Fourth, contact your member of Congress. Their offices have staff dedicated to helping constituents with federal agency issues, including Social Security. This service is free and often very effective. Fifth, understand your right to appeal. If you believe a decision is wrong, you can challenge it. You typically have 60 days to act, so do not delay. The bigger picture. This situation reflects a larger question about responsibility and fairness. Social Security has long been considered untouchable in politics because it directly affects millions of voters who understand its importance. Instead of reducing benefits directly, these changes have targeted the system behind the scenes, staffing, infrastructure, and operations. The expectation may have been that fewer people would notice, but they have, and frustration is growing. Final thoughts. Aging is already challenging. No one should have to fight for benefits they earned through a lifetime of work. Social Security is not a handout. It is a promise, a system built on contributions made over decades. That promise must be upheld. The encouraging news is that this situation can be improved. Funding can be restored. Offices can reopen. Staffing can increase. But it requires awareness and action. Do not stay silent. Stay informed, hold leaders accountable, ask clear questions, and expect clear answers. And most importantly, support one another. Share this information with others who may need it, because every informed person is one less person left struggling in a system under strain. You earned these benefits. Now it is time to ensure the system works for you.